questions. So we now have 31 people in the room, so we might make a start. Welcome to Activate's Leadership Series. Today we're talking about mental health and safety plans. Hayley is a registered psychologist and I'm the principal consultant and director at Activate. Hayley's specialisation is in developing safety plans, and typically what we do is we develop safety plans for people once they are employed. Today we'll be looking at what you can do to build safety plans for those people that you intend to employ. Many of us are doing risk assessments for people once they are employed, but what about doing risk assessments for those people before you employ them? Let's take a look at this phenomena today and unpack it in the 30-minute time frame that we have.
Is that a challenge?
It's a challenge. It's a challenge. And I think it has a lot to do with the fact that we're all zoomed out, Hayley, aren't we?
Yeah.
And so that's why we've given people a chance to do this 30-minute presentation, to sit in on the 30-minute presentation and listen to us talk about this, this topic that is often overlooked by hiring managers and HR managers.
Mm-hmm.
So
and we've
today
seen a couple of instances of that.
health welfare in the recruitment cycle. We'll be exploring what mental health welfare looks like before someone is actually employed. Hayley will then talk to you about what a safety plan is and how you can implement this safety plan before you engage this person in open employment. We'll also talk about building a safety plan for someone that you've identified that has a mental health risk. And this, of course, is before they're employed. Now, you can utilize this information for people who are already in your employ. So the information Hayley will be sharing with you is interchangeable. It's not just for people who you are yet to employ. Now, why are we talking about this? Well, it's very topical at the moment. Many of you do pre-employment medical screening. Many of you are asking more about how can we identify psychological factors during the pre-employment phase. We encourage you to think about that and think about the fact that there's a lot that you can do before you employ someone. Most of us are worried about discrimination. Most of us are worried about all the intersecting legislations that are present at the time of the employment phase. We're going to talk about that a little bit this morning, and we're also going to give you some takeaways that you can build into your recruitment program. Okay, so we know that 1 in 5 Australians will experience a mental health issue during their working life. And certainly in the community, we've learned more about mental health in the last 10 years than we've ever known. The stigma of mental health in our broader community is changing, but it's not changing in our workplaces. Why is that the case? Well, we know there's no legal obligation for a worker to disclose information about any disability, whether it's a physical or psychological one. Disclosure is a difficult choice for a worker to make. And why would you if you don't have to? If you've been performance managed in your past job because you've had a mental health issue, the last thing you're going to do before you take this new job is tell the hiring manager or HR manager that you've got a mental health issue. Exposing your vulnerabilities is a difficult choice to make. It's a personal decision, and it has a lot to do with how you are managing your own illness. If you have a significant mental health issue, perhaps a long-standing one, you might think that you have carriage of that problem, that you have the right supports, the right scaffolding in place to ensure that when you are challenged, you have the support structures, whether they are medications, psychologists, psychiatric support, good services and support in our community, and a great connection through our family loved ones, and community organizations. But what about when we're challenged? What about when people are moving into a new role and they are stressed, they are concerned, they want to perform? How can we try and build this bridge between the unknown, the person's mental health status, and how they're going to perform in their new role? So we're encouraging you to open up this taboo topic and think about how you're looking at a prospective employee. We're all on our best behavior. When we're hiring people and interviewing people, we want to like that person. We want to believe we can make a difference by bringing that person into our organization. It's just a natural human thing that we want to like someone. It's also natural for us to want to know more about their past, want to know more about their workplace functioning. So today, we're going to give you some insights about what you can do to try and build a greater understanding of how this person's going to perform. Will an employee disclose their mental illness to you at interview? Well, it's unlikely. And it certainly happened in my experience where we had a psychologist coming for an interview, and in his last interview, he told us that he had a past history of schizophrenia. Did we agree to employ him? Of course we did. Did we want to discriminate against him? Absolutely not. We cherished that he was open and disclosed that information. And what we did was build a safety plan with him. It encouraged us to have that open, transparent communication to make sure that he was safe when the chips were down. And we had a plan that we could roll out when we both could see that things weren't quite right. And this may not necessarily be visible to the person who has the mental health issue. They might just be going about their business and thinking everything is okay. When you have this relationship that you've built on trust, that might even happen before they're employed, and we certainly recommend that you do this, then you've got an exchange and you've got this capability of having this open discourse. The question I pose to you is, if there are 3 key risks to resilience that lead to poor performance, then what are they? Well, we believe that they are 3 distinct areas: people risk, challenge risks, and symptom risks. People risks are to do with the person's relationship building, relationship management. Let's explore what that is before you engage the person. Challenge risks are to do with their hardwiring, their personality profile, how they respond to stressors. And symptom risks are to do with the current symptoms they might have. How do they experience depression, anxiety, symptoms of distress? Do they have a history of difficulty managing those symptoms? Or do they have a robust plan in place that they themselves are confident in? We do a lot of pre-employment screening, and certainly in recent years, there's been a greater focus on identifying resilience in that pre-employment phase. And interestingly, in the digital screening we do, what we learned is that candidates are 3 times more likely to reveal mental health history in a digital pre-employment screen. So there you go. When you have a face-to-face screen, there's a bias that emerges there between the doctor, the physiotherapist, the psychologist, the occupational therapist, whoever is doing this assessment. It's almost like our role as health professionals is to pass that person. But we need to move on from this notion of pass and fail medicals. They really are risk assessments. And our job is to identify those risks and help that person understand they have an onus of responsibility to manage those risks in their personal life, their private life, and in their working life. Hayley's now going to talk to you about what this safety plan can look like before you engage someone in employment. Over to you, Hayley.
Thank you, Rob. So what is a safety plan? Well, instead of thinking, yes, pass or fail, fail being there are too many risks and then letting them go, what about the concept of a safety plan, a mental health safety plan, which is really to have that individual come on board, but protect them around what is harmful to them. So this includes identifying what the harm is to themselves, others, and from others. So for example, having a suicide risk is harm to self. A homicide risk would be harm to others. Or being a victim of domestic violence is, or an aggressor in a, say, previous workplace or somewhere else, is then harm from others. So a safety plan is in place to cover any kind of harm, not just suicide risk. That way, safety plans aren't so stigmatized. It's only for those who are really dysfunctional. No, it's just for a temporary measure to help them manage that risk that they are trying to overcome. So this plan should be personalized to make sure it's meaningful for that individual and guides that individual and their trusted sources through that risk. So you've all got to work as a team. And it's important that this plan is to be developed in consultation with that individual and with the individual's trusted professionals, a GP or psychologist, psychiatrist, whoever the individual considers the most trusted source, because this plan, it requires a lot of information and a lot of disclosure. So the more specific and useful the plan, the better it is to be consulted with their trusted professionals. And without that individual's input, a planned safety plan then just becomes unhelpful and dismissive of the individual's concerns and triggers. So firstly, it's important to make sure that we obtain consent from the individual to developing a plan if needed, or ask them if they already have one in place. So in the pre-employment screening, there is a psychosocial section which will reveal that the individual has a diagnosis. As Rob mentioned, that most individuals are likely to indicate that more digitally. And so it's going to appear. So when it does, do you just throw them in the too hard basket and then fail them? Well, no. Let's develop this safety plan, and I'm going to use an example of, say, somebody who has disclosed that they have had post-traumatic stress disorder, PTSD, and that they have undertaken sessions through a mental health care plan, and their results on the DASS-21 is high on anxiety and stress. So you might think this poses a risk to the organisation applying for a job that requires them to relocate to a remote location, say as a truck driver. And that's a lot more risky because in a remote location, there might be less access to mental health professionals, or that individual doesn't have yet established a social support system in that new area. And maybe driving a truck might place the individual at harm if they experience any triggers that are related to the job, or they have a panic attack. But it's best not to make assumptions and instead always ask the individual if they do have a safety plan, or if they maybe have had one previously, and ask if they're open to developing one to protect them from experiencing exacerbation or relapse on the job. So what goes in a safety plan? Well, the most important information to capture is what are their early warning signs? What are their triggers? What are their symptoms that they are struggling with? Whether it be a panic attack, or even just early warning signs such as feeling tired or not sleeping properly, not eating properly, loss of appetite, withdrawal, or triggers such as, for instance, for a truck driver, maybe it's it's going to mine sites or driving across bridges or accident sites, provided that's not the day-to-day job and those can be prevented, those can then be integrated into a safety plan to then manage it. And for somebody who has a bit of suicidal ideation, perhaps the triggers for that can be being alone with a high volume of prescription medication that can risk them overdosing on a stressful day. So early warning signs and triggers and symptoms are unique to each individual experiencing mental health condition. So we can't assume that the early warning signs look the same for the same kinds of conditions. Then we then note down the immediate strategies that the individual has learned from their treating practitioner, such as breathing techniques, grounding techniques, and mindfulness, even walking away from a particular situation or pulling over on the side of the road and calming themselves down, praying if they have a religious connection, or even just thinking of their loved ones, or some kind of immediate coping strategy that they've picked up from their sessions. And these are meant to be self-soothing and immediate and ready to be there, rather than it being too difficult to implement at the time. Next, we want to identify how to make and build the safe environment for that individual, which includes reasonable adjustments, at least for a reasonable amount of time. And that just depends on the organization. So it can include removing hazards or relocation or reallocation. For example, removing certain hazards that might risk them from relapse, such as for somebody who's recovering from alcohol dependency, removing the alcohol that is in their environment if they're working from home as much as possible, relocating somebody who might be a risk of being a victim of domestic violence and relocating them to a secured, safe work environment instead of, say, working at home, if permitted, and reallocation of, say, a high volume of that prescription medication that they may have overdosed previously on, and maybe just trying to limit the volume of prescription each time. Then there should be a few emergency contacts, and be careful with this. They should be the trusted confidants, not the person who's the perpetrator or a person who is an enabler. So these emergency contacts should really be people they can turn to in times of need. And it should have their phone number, preferably two phone numbers, and an email address if they feel comfortable disclosing that. And these individuals must be consulted prior to putting their details on the safety plan. They need to know what the safety plan is as well. And also favorite things. What is this individual's favorite things? Because this is unique to them. And it's little things that they can enjoy in their daily life that are outside of work and that get overlooked quite easily, such as a barista-made latte. I made my own latte this morning. The smell of fresh green grass, which I will be smelling as soon as I come out the door because it's been nicely raining. Thinking of your children or horses or playing tennis, reading literature, learning something new. Try to just list 3 things that then kind of break the ice and are just favorite things that bring them that little smile. And then lastly, make sure that their treating parties are on there. So they're treating psychologist, psychiatrist, GP, or even it can be a community support. So if they are involved in the SES, do they have a mentor in the SES or somebody who's a trusted person or a pastor or religious leader? Anybody, they should be noted. And then of course, maybe 2 or 3 of the 24/7 support lines and 000, just so that they've got it ready to go. So all of this should be on one page. Try to condense it, keep it succinct, so that this one page is easy to go to. It's easy to look at when that individual is experiencing some distress. And it is recommended that a copy is given to each of their treating parties and their emergency contacts, and hopefully the employer. Now, it is a very private document. So this is where it's important that the employer, especially if it's a new employer, that you do develop that rapport. And so that leads me into, okay, how to have that conversation. This is the tricky part, right? And the key is just be sure that you're conveying that you care about this individual. That's it. You care about them. So prepare the conversation to make sure that you're not striking them down where they're at and you're not patronizing them. It's just more about explaining this safety plan is going to be temporary and it's just going to keep you safe. Not keep us safe from liability or litigation. It's no, keep you safe first and foremost. Everything else will follow. Then just ask. Make sure you check in, ask. Do they want to develop a safety plan, or ask if they have one? And if they don't want to develop one, then leave it. Can't force them to. However, do listen to what they've got to say, what their concerns are, or what might be upsetting them. And then just encourage and recommend that they do look into developing one if they're not willing to have one, and connect them in with a confidential source. They can even develop one with one of the support lines. So you can always give them the support line a call and then hand the phone over, and then they can continue the conversation and then check in with them. So be sure that you set a time frame for checking in. That's in consultation with that individual. Can I check in with you maybe in 2 weeks or maybe 1 month? Because keeping in mind, a safety plan is not permanent. It's not a contract. It's not forever. It's just helping that individual with that initial adjustment phase or that initial relapse prevention phase. It's temporary. It can be updated. And then once the risk is managed, it can be relinquished. So let's not connect the person to a safety plan, rather what they're going through, that requires the safety plan. So what are reasonable adjustments? And I'll give this over to Rob to then discuss in further detail. Take it away.
So we've talked a lot about how to build a safety plan. And I think many of you are probably sitting there thinking, well, this is a very confronting topic, isn't it, Hayley? Having this conversation with someone, even before they're employed with you, can be a very affronting discourse. What we're suggesting to you is that you take the time to consider that an employee has to make a giant leap of faith if they're going to disclose their mental illness to you. And what you want to be doing is thinking about, well, what are the reasonable adjustments? The safety plan is the best way of ensuring that reasonable adjustments will be enduring. Now, yes, it's a temporary plan, but it may be a plan that you go and revisit again and again. And it's an important contract, if you like, between you and that person about how they're going to manage their own mental health issues and how you're going to support them. This is very, very crucial that you do this prior to employing people. Now, we certainly know in our own experiences that there's often a tension between HR and hiring managers. And in 2 instances very recently for us, we've had hiring managers promise a person the position on the basis of them passing their medical. Now, when we undertook the medical, we learned that this particular person, and I'll start with one example, she had a long history of psychiatric dysfunction. And from what we could glean in our interview with her and in her disclosure, her current condition wasn't properly managed. So she didn't have a robust safety plan in place. We went back to the organisation. In this instance, they were a government, New South Wales government department, told them about this, and they then explained to us that they had already been promised a position. So we helped them craft a safety plan. This is not about discriminating. This is about giving people the opportunity for this open discourse. Yes, it's a taboo topic, but you want to be doing it before the employment begins, because it's going to be a lot easier to have that difficult conversation if you have an established safety plan. As Hayley pointed out, it's vital you do this under the auspices of a very confidential and very private discussion, and a safety plan that is a very intimate one. This is a very intimate discourse that you've had and a contract that you've created with this person. You cannot be cavalier about the importance of this document, and the person, more importantly, shouldn't be cavalier about how they're managing their mental health. If it's in a safety plan, enshrined in a document that you can both revisit again at a later stage, then the chances are that you're going to be preventing liabilities like workers' compensation claims from happening. And that was one of the questions from our audience earlier. Can a safety plan mitigate a workers' compensation claim or exacerbation? Absolutely. This is one of the key reasons why we're suggesting that you do this before employment begins. So what about the supports? Over to you, Hayley. We haven't got much time left, so over to you. What are the supports that you're recommending form part of a safety plan?
So the EAP is usually the best, well, the easiest one, since if they already have an agreement with that organisation, they're quite familiar with the nature of the organisation and the roles, and it's just easy to give them a call, and there should be at least about 3 sessions, so that building a safety plan can then be across 3 sessions, since it's somebody they might not know. They can do it with a GP, which Mark Allen's question, yes, this safety plan can be developed with a GP or any of the supports that are listed here. But my recommendation is that it is developed with who the individual decides ultimately. If we want quite a vague and a general safety plan, then the individual can develop it with the somebody they don't really know, just for the sake of putting something in place. But if we really want a meaningful safety plan, then we do recommend that they do develop this with a psychologist that they have an existing relationship with. The psychologist can then add in the strategies that they've worked through, and that way they can continue to practice that. And yeah, those hotlines as well, those support lines are available 24/7.
Mark, there may be instances where there's an emergency situation and you can use the mental health suicide callback line. You can Google that and you'll get the phone number. They can also help build a more emergency plan where the person may be going through a period of distress, and you want to make sure that there's a robust system in place to support that person outside of the organisation. So yes, there are plenty of services available. You've only got a few of the many services available up there on the screen.
And all the different GPs and psychologists have their own safety plan templates. The one that I've showed you is what has worked for my clients. So other safety plans might not have favorite things, but I've added that in there just as a little